Good evening, ladies and gentlemen. This is USMLE videos.net. Tonight, we are going to discuss anorexia nervosa. Before I start, I want to welcome you to our website at www.usmlevideos.net, where you can browse through hundreds of videos that are featuring the most important points you must know for USMLE examination. Tonight, I would like to give you a brief introduction about anorexia nervosa. This is a eating disorder, and the main features of this disorder are as follows: refusal to maintain normal body weight. Patient is usually a female, a young female, and she entertains that fear of weight gain and the body image disturbance. Because she has this distorted fear, distorted reality, she will have nutritional deficiencies in her body. Because of those nutritional deficiencies, she will be losing hair and she will be having amenorrhea. And so those are the basic issues. Number one, it's an eating disorder. It's characterized by refusal to maintain body weight. And number three, there is an associated fear of weight gain. Now, what are the main types of anorexia nervosa? There are two types. Number one, restrictive type. This patient usually restricts her eating. Number two, binge eating or purging type. In this, the patient usually binges herself over large quantities of food and then she vomits it. So these two are the two main types of anorexia nervosa. What are the systems involved? Cardiovascular system, patient usually has bradycardia. Number two, endocrine system is involved. Patient usually has low T4 and low FSH, low LH, but normal TSH in this disorder. Number three, metabolic. So many metabolic functions like normal weight gain is less in these patients. Number four, gastrointestinal problems. These patients usually have these nutritional problems because of infrequent eating. Then nervous system is also involved. And finally, reproductive system is involved. Now, what is the predominant age for anorexia nervosa? Patient is usually between 13 and 18 years of age, and it is usually a female. Almost the ratio of female to male is 20:1. This disease is globally present. Patients usually have negative self-evaluation, and they sometimes have this overachievement pressure, the academic performance. Then you might also find some psychiatric disorders in their parents. Now, how do we diagnose anorexia nervosa? First of all, we need to see the signs and symptoms. Patients usually have amenorrhea, they have this preoccupation with body size and weight control. No matter how much you prod them, they always say, well, I am gaining weight. But you would look at them and see that they are emaciated people. Now they also have elaborate food preparation and eating rituals, maintaining strict diaries of what they ate and how much quantities they ate. Then they have weakness, fatigue, cognitive impairment, memory disturbances, hypothermia, cold intolerance, constipation, bloating, and lanugo hair, dry skin, scalp hair loss, peripheral edema. hypotension, bradycardia, murmurs, decreased bone density, and fractures. In vital signs, you usually see bradycardia, orthostatic hypotension, body weight less than 85% expected. In cardiac abnormalities, you will find dysrhythmias, mid-systolic click of mitral valve prolapse. And as I mentioned earlier, patients will have dry lango, hair loss, edema. Neurological abnormalities include seizures and shaking and anxiety, nervousness. Now there is no specific test for anorexia nervosa, but if you do laboratory examination, you will find abnormal liver enzymes, low LH, FSH, and hypoglycemia, hypercholesterolemia, hypercortisolemia, hypophosphatemia, low sedimentation rate, anemia, leukopenia, thrombocytopenia. And on ECG, the main finding is prolonged QT. The prolonged QT interval is one of the main things you find on EKG. Now, these patients will also have low bone density. You need to do a DEXA scan, that is dual energy X-ray absorptiometry DEXA scan, to evaluate the bone density. As I said, there are two main types, restrictive type and binge eating purge type. Now let me ask you a question. What are the screening tools for anorexia nervosa? Number one is SCOFF questionnaire, SCOFF, SCOFF questionnaire. There is eating disorder screen for primary care, ESP. There is eating attitudes test, that is EAT. There is eating disorder inventory, that is EDI. So those are the screening tools we have. Hyperthyroidism, immunodeficiency, inflammatory bowel disorder, these should be eliminated when you examine these patients. Now let us see a few things about treatment. How do you treat these patients? Number one, weight restoration. You need to gain at least 0.5 to 1 kilogram per week in order to restore their normal body weight. Secondly, cognitive behavioral therapy. Third, family therapy. So you need an interdisciplinary approach between primary care physician, a psychologist, and a dietitian or nutritionist in order to give the cognitive behavioral therapy and family therapy along with the regular care you give to this patient. And the weight gain, then you need to treat the other things like cardiac arrhythmias, and there is no specific medications but SSRIs, serotonin selective serotonin reuptake inhibitors, SSRIs. The main one is Prozac. You can fluoxetine. You can start like 10 milligrams and go up to as much as 60 milligrams to treat these patients. And these patients also sometimes will have comorbid conditions like depression and obsessive compulsive disorder. So that is the treatment: weight restoration, cognitive behavioral therapy, family therapy, SSRIs. Now let me recap. So anorexia nervosa is basically characterized by distorted body image, fear of weight gain, and as a result of decrease in nutrition, there are so many neurological, metabolic, and reproductive and endocrine dysfunctions that happen in these patients. And cognitive behavioral therapy, family therapy, weight restoration, SSRIs help these patients in the treatment section. That's about anorexia nervosa, and please post your most important points on the comment section at www.usmlevideos.net. That is www.usmlevideos.net. Thank you. Have a good night.